Seasonal flu is mostly prevented by getting vaccinated every year and is treated by flu antiviral drugs. However, we can lower the spread of germs and prevent respiratory illnesses such as the flu by good health habits, such as covering your cough and washing your hands regularly. This video presents healthy habits to prevent flu. Firstly, we should know about flu. So what is flu? Influenza, known as flu, is a communicable respiratory ailment caused by influenza viruses. Influenza ranges from mild to severe. Patients may require hospitalization. In some cases, it can lead to death. Some people with a weak immune system, such as young children, the elderly and people with certain health conditions, run a high risk of serious flu complications. The influenza viruses are categorized into type A and type B, both of which routinely spread from person to person, causing seasonal flu epidemics every year. Symptoms? If you are wondering whether you have the flu or not, here are some symptoms you should be cautious. Fever or feeling feverish, chills. Cough. Running or stuffy nose. Sore throat. Feeling tired. Muscle or body aches. Headaches. Fatigue. Vomiting and diarrhea, more common in children. Flu and the common cold show the same symptoms, but they are actually caused by different viruses. Flu is more serious than cold with more intense symptoms. While people with cold will mainly have problems with their runny or stuffy nose, and it doesn't lead to any serious health problem, flu patients can have very serious associated complications including pneumonia, bacterial infections, or hospitalizations. Common preventions. Avoid close contact. Stay away from sick people and distance yourself from others if you have any signs of flu to prevent its infection. Do not go out when you are sick. If possible, don't go out until you recover completely. This is highly recommended to bar your sickness from spreading to others. Cover your mouth and nose. Always cover your mouth and nose with a tissue when coughing or sneezing. Flu and other serious respiratory illnesses such as respiratory syncytial virus, RSV, whooping cough, and severe acute respiratory syndrome, SARS, can be transmitted by coughing, sneezing or unclean hands. Face masks are also recommended during flu season. Keep your hands clean. Sanitize your hands with soap or an alcohol-based hand rub to protect yourself from germs. Take 5 simple but effective steps. Wet, lather, scrub, rinse, dry to prevent diarrheal and respiratory illness. Curb touching your eyes, nose or mouth. Germs can easily get into your body when your contaminated hands touch your eyes, nose or mouth. So keep your hands away from these body parts. Follow good health habits. Sterilize frequently touched surfaces at home, work or school, especially when someone has signs of illness. Get enough sleep, do exercise regularly, relax and reduce stress, drink plenty of water, and go on a nutritious and healthy diet. Preventions at work and school. At school, check if your child's school, childcare program or college provides any plans or vaccinations in case there is an outbreak of flu. Make sure that frequently touched objects and surfaces at these places are routinely cleaned. Sanitary wares such as tissues, soap, paper towels, alcohol-based hand rubs, and disposable wipes are sufficiently provided on site. Ask how sick students and staff are separated from others and who will take care of them until they can go home. And your workplace. Check available plans and vaccinations in case of an outbreak of flu or other illnesses. Make sure that frequently touched objects and surfaces at this place, such as doorknobs, keyboards, and phones are routinely cleaned. Check whether sanitary wares such as tissues, soap, paper towels, alcohol-based hand rubs, and disposable wipes are fully provided on site. Train your colleagues to do your job so they can fill in for you in case you have to stay at home because of sickness or any of your family members get sick. If you feel sick, go home immediately. What do you know about flu? Tell us in the comments section below. Thanks for watching. If you find this information useful, please give us a thumbs up and share it with your friends.